Hello, I'm Darsan Kara. I'm a final year student of Jalalabad State University. I'm going to talk about erectile dysfunction. So let's start with definition. It is inability to develop or maintain erection during intercourse. It is also known as impotence. Before you get to know about erectile dysfunction, you have to know something about anatomy of penis. It is made up of three long cylindrical body, corpus spongiosum that covers penile urethra, and two corpus cavernosa that made up of erectile tissues. A fibrous cord called tunic albuginea wrapped around corpora cavernosa. There is blood-filled space called cavernous space where there is presence of cavernous artery that supplies the penis, and this blood drains into deep dorsal vein. There is both somatic and autonomic nervous system supplied by cavernosa nerve. In case of physiology, this penile erection is neurovascular event that modulated by psychological factors. Like there is parasympathetic nervous system that releases acetylcholine that will act on muscarinic receptor of endothelial cells, and this will activate nitric oxide synthesis. And this nitric oxide synthesis will convert arginine into citrulline and nitric oxide. This nitric oxide will diffuse and will sit on smooth muscle, and this will activate guanylyl cyclase, and this guanylyl cyclase enzyme will convert GTP into cyclic GMP. The cyclic GMP will decrease the intercellular calcium. As a result, there will be smooth muscle relaxation, and there will be cavernous space will be expand, and it will be filled with blood. And the corpora cavernosa size will be increases, and it will compress the vein. As a result, there will be less blood leaving the penis, and more blood is coming. As a result, there will be stasis of blood in penis. It will help in make the penis erection. There is two type of erectile dysfunction: primary and secondary. Primary means it's present from the first attempt at intercourse, and secondary means it develops after some normal period of normal function. In case of causes, the main cause is psychogenic. In psychogenic cause, there is performance anxiety, relationship problems, difficulties, and depression, stress, and there is also excessive alcohol consumption. In case of vasculogenic causes, there is atherosclerosis, where there is formation of plaque that damages the artery that supplies the penis. Also, in case of hypertension and trauma. In neurogenic, there is a stroke, spinal cord injury, and diabetic neuropathy. In hormonal, there is hypogonadism, means there is less production of sex hormone. Or in prolactinemia, where there is more production of prolactin that reduces the amount of testosterone in the body. The other cause mainly the old age. With increasing old age, there is increases chance of developing erectile dysfunction. Another one is diabetes mellitus, coronary heart disease. So there are some medication that can leads to erectile dysfunction, like beta blockers, propranolol, diuretics, antidepressant. And there are some risk factors for erectile dysfunction, like aging, chronic disease conditions, smoking, alcohol, obesity, etc. No, so you have to know something about diagnosis. Well, there is no specific test to diagnose the erectile dysfunction. The diagnosis relies on sexual experience of individual. We also can question or take history, like medical history, surgical history, any medication, or the individual is taking any drug. We have to assess the patient, like we have to ask thorough history about medical, sexual, like has there been any previous period of normal function, does erection occur on walking or in response to masturbation, is there any evidence of alcohol or drug abuse. Other than that, we can do some investigation like serum testosterone, serum prolactin, and screening profile of sugars, lipids, thyroid functions can be done to investigate the erectile dysfunction. So the treatment part is largely focuses on underlying causes. We have to treat the underlying cause first, and before that, we have to tell the patient about smoking cessation, reduce alcohol, weight loss, and exercise. Other than that, we can do some psychosexual therapy, like we have to will counsel the patient about relationship, and there is some drugs that can help to treat the erectile dysfunction, like oral agents like in phosphodiesterase type 5 inhibitor. Actually, the mechanism of action of that is the phosphodiesterase break the cyclic GMP. If we inhibit this, there will be increased cyclic GMP. Then there will be smooth muscle relaxation, and that will facilitate the erection. Other than that, there is intracavernosal injection like prostaglandin E1, alprostadil, and intraurethral injection. There are some PDE5 inhibitors we have to know, like sildenafil, also known as Viagra, tadalafil, vardenafil. There's some side effects like of PDE5 inhibitors, like facial flashing, headache, nasal congestion, dyspepsia, and visual disturbance like blue halo. Other than that, there is vacuum device which also can help in erect the penis. It will create the negative pressure around the penis, and it will help in erection of penis. Other than that, there is some surgical procedure like penile prosthetic implant. It will not cause erection, but it will help the penis in rigid position. And thank you for hearing me out. And that's it from my side.